Hey everyone, it's Olivia from Live Well Health Centre, and today I'm going to talk you through some acute neck pain common causes, how they can present, what you can do at home, and what we can do for you in the clinic to help you manage through. So firstly, what are some common causes of acute neck pain? So I'm sure many of you relate to waking up in the morning and you've just been sleeping. Somehow you've got a really sore neck and can barely move or head check. And this is called a wry neck. So happens when the muscles in your neck shorten and contract and cause a really tight neck. And that's a very common complaint that we see in the clinic. Another is called a facet sprain. So we have these joints in our neck. Up here, this is our neck. And these are facet sprains just here. And sometimes when we turn a bit too quickly or look up in a really awkward position, we can sprain these joints here, and that's also a really common complaint as well. What happens with some of these conditions is that the pain can actually refer to another section of your body, commonly the shoulder possibly, or like the upper shoulders and even around the front of your neck as well. So getting some pain here as well. And that's really important to remember when we are managing acute pain, because we often focus on this area, but doing some love around the other areas as well can also help. So what can you do at home to help you get through the day and carry on? Some really simple things include a heat pack. Trusty heat pack, all you want to do is pop it on the back of your neck like so. And just leave that there for 15-minute intervals until it cools down, and repeat as much as necessary till you get a bit of tension relief. Another one is a spiky ball. So talking about those referred areas, we can pop this at the back of the shoulder against a wall, and you just want to rub side to side to roll out any of those knots there or any trigger points that are particularly sore that day. That's a really good one. And you can also use topical creams like Voltaren, Danko Rub, or Ice Gel. So these are creams that you can purchase from the pharmacy, Chemist Warehouse, anything like that. And you just want to rub them to the area. Just double check with your doctor it's okay to use them before, or do some research to make sure you're not on any medications that conflict with them. But they're usually safe for most people. So you can just pop them on the area as well. Some light stretches are really helpful as well. We want to keep the area as mobile as possible, even though it might be painful. So a key note to take home here is that if pain levels are between 3 to 4 out of 10, that is okay. It might be slightly uncomfortable, but stretching is usually good for these sort of situations. So some really simple stretches you can do is popping your hands on your chest, just pressing down and dragging your hands down so you feel some skin tightness here. And then you just want to look up within your pain range. So if you can only get up to there, that's fine. And then looking sideways and the other way. Another really good one for a muscle strain. Sometimes you might wake up and like all of here is really tight. Is a levator scapulae stretch, which is a muscle that runs from the base of the neck to the shoulder area. So you just want to sit on the sore side, your hand, tuck that under your bum and sit there. And then with your other hand, just grab the side of the head and pull your head slightly sideways. So again, just staying between that pain range or when you feel the stretch, and then ease back up, and you can do the other side as well. So sitting on this hand and looking that way. Beautiful. So how can we prevent this from happening, or at least reduce the likelihood of it happening? We need to look at some more lifestyle factors like your pillow. A lot of us have quite flattened pillows that haven't been changed for years, or we've just not thought about our pillow. And a great alternative to reduce acute neck pain is a contour pillow. So it's the one with the big dip. You might have seen it around on the internet or anything. They are really good to help keep our neck in a neutral posture throughout the night. Also, getting a good night's sleep is a part of managing acute pain as well, and influences our tolerability to pain and how much we perceive pain. So something like a pillow, A, is good for neck posture, and B, getting a good night's sleep will help pull you through as well and just manage pain a lot better in general. Osteopathic treatment is another great option for managing acute neck pain. Here at Live Well Health Centre, we'll conduct a thorough assessment to screen for any conditions and figure out what exactly might have happened to you. From there, we can use a range of massage, dry needling, joint mobilisation, so moving the neck around within your pain range to provide some pain relief and manage any inflammation. If you have any concerns or questions, please contact us and book in an appointment if you think you need some neck loving. Thanks, guys.